Oh, the recording is happening. So welcome, everybody. Thank you for joining us. We have a relatively brief agenda actually today, so time for questions if they come up. I'm sad to say that our good friend Chad is not able to be with us today. He has a different commitment. He sends his best to everyone. So I and the rest of the team are filling in. So with our updates today, we wanted to start off with, all things COVID, because that's how we got started with this. And then we'll move on from there to other more current topics. We wanted to update you on issues around the EUA for COVID vaccines, and then also talk a bit about some of the new masking guidance and what's happening in the hospital setting to be able, many of you have been reaching out to us asking about what is happening there to potentially be able to inform your own practices. So first of all, for the new EUA for COVID vaccines, this is regarding the disposal of vaccines that have either expired or are no longer recommended. So just as a reminder, providers must dispose of the J&J Janssen COVID-19 vaccines. That all of those expired essentially on May 6th, 2023. And then additionally, as you are well aware, the monovalent Moderna and Pfizer COVID-19 vaccines are no longer authorized for use in the US, only the bivalent. And so any inventory that you have of those materials should be disposed of as medical waste and then reported in NICIS. So wanted to make sure that you all were fully aware of that. In talking about some of the policy changes and things that are kind of being adjusted around masking, we get a lot of calls around the masking guidance, I think, because we're all struggling to know what's the right thing to do for patients and for our staff. The policies will be updated effective Monday, May 15th at both Strong and Highland hospitals. And I'm going to just sort of read through this to you just to capture this data. So essentially the new masking policies for both hospitals are based on location and services. There's going to be new signage that's going to be up that's going to guide staff and patients and visitors, a similar process I'm sure you're following in your own offices in terms of letting people know if your policies are changing. In the inpatient settings, I guess my framing for all this seems very like a lot of common sense to me. Actually, it feels like a lot of common sense. So I think you'll hear the same thing. In the inpatient settings, masking is required for staff when they're providing direct patient care, when they're in patient rooms or other inpatient settings like procedure rooms, or when transporting patients between rooms and services. Staff are encouraged but not required to wear masks in corridors, nursing stations, or public areas unless patient care is being provided in those areas. Staff who were not vaccinated for influenza, going back to past procedures and policies that were followed, though they must continue to mask at all times in areas where patients are typically present until the New York State Health Commissioner determines that the flu season has ended, and that determination has not been made yet. And masking is encouraged for patients and visitors, and masks will be provided on request. So there's no requirement around masking for patients and visitors, but masks will be readily available. They talk a bit about special circumstances. So, again, common sense, right? In places where patients may be especially vulnerable, like the Wilmot Cancer Center Tower or select outpatient infusion centers, and also, in clinical areas like that, everyone is required to mask in all public and in all patient areas. And in such areas, masking will remain optional if people are in a private conference room or break room where the doors are closed and no patients are present. Shifting from inpatient to outpatient. So in the outpatient ambulatory settings, masking is encouraged for staff, patients, and visitors. Staff are required to mask upon patient request in an effort to help all patients feel safe and comfortable. And staff who are not vaccinated for influenza, it's the same thing again, must continue to mask until the health commissioner determines that the flu season has ended. I think this sort of feels like how we would have ideally been doing business even before the COVID pandemic, but maybe didn't have those processes in place. So it feels to me like from a common sense standpoint, this should be readily rolled out. In terms of a few other things, just so people are aware, effective Monday, May 15th, again, at Strong and Highland Hospital, the patient pre-admission testing is being discontinued for asymptomatic patients. They will continue to test patients who have symptoms, as we've always done for patients with symptoms of other infectious illnesses like flu or RSV, but asymptomatic testing is being discontinued. And then some changes in terms of employee COVID screening and testing, again, effective still the Monday, May 15th date. Employees must notify their manager or their supervisor of absence from work following their department's call-in procedures. Employees who have symptoms that suggest an infectious illness should be fever-free for at least 24 hours without fever-reducing medication, and symptoms should be mild and improving before returning to work. Again, like just sort of what we would expect we should be doing in those settings. Employee health will no longer routinely be providing COVID testing. So they are suggesting to employees that if you feel you need to be tested for COVID, to either use a home test or contact their personal healthcare provider. So I hope that some of those things will help as you're looking at your own in practice, procedures. I think many of you may have implemented some of these changes already. But I know, we've really tried to be conscientious as a community to be sending some of the same messages and being able to refer back to in the hospital setting. This is what's happening. This is what's happening in our primary care practice, whatever setting we're in. So we hope that that's helpful. I appreciate you letting me just read the list off so you've heard it. This will be included in the messaging that Jana sends out for us after the meeting, and so you'll have the written documentation of this as well. I think the other couple of things shifting from COVID that I just wanted to make sure that I talk about with all of you, we wanted to make sure that you were aware that many of you have been reaching out to us about concerns around safety net reimbursement for all kinds of services under the Excelis plan. So things that should be covered that are not being covered currently in terms of the coding and reimbursement, whether it's screening or whether it's some specific service provision. We thought that had been resolved, and it's very clear that it's not. So we want to make sure that you all know that we are raising that to a high level of urgency and asking for specific communication and addressing of this that will be clear to all of your practices. So if you have specifics that you want to share with us, you can do that. But I just felt like it'd be better for you to all know many of the practices have reached out. And so we are on this now. And then my last thing, actually, before I turn things over to Jana, just as a reminder, we had talked about the fact that HPV vaccine is launching, the American Cancer Society is launching a new campaign, which is the Start by 9 campaign. We've talked about this in different venues. And we're excited to see that actually is really being launched this month. As they had said, you're going to see some additional communications coming from us in network news. They have nearly 50 different organizations across the New York State region and beyond who have signed on endorsing this. It really is important to look at HPV vaccination as a cancer prevention treatment. And this really allows us to begin to frame the conversation better in that way. So please keep an eye out. We're more materials coming in, obviously, for our pediatric and family medicine teams that are, this is part of the work that you do every day. We've got some additional resources that we'll be pushing out to you as well. Renee, anything that I missed before I switch over to Jana? Anything you want to add?
I think you crushed it.
Oh, Renee's always good for my ego. Okay. So before I turn to Jana, I'm going to turn to Robin because we have a new member of our AHP team that Robin's going to introduce, and then we'll turn it over to Jana.
Thanks, LJ. I am delighted to introduce Megan Willis. This is her very first day. There she is. Megan is joining the pediatric care management team as a pediatric outreach worker who is really going to be supporting our social work care managers as focused on social drivers and community outreach, really providing them some partnership in working with our most complex cases. And she is one of two. Our next hire is starting next week. And again, we are we are very happy to have her here and really looking for the sort of next growth opportunity among our team and in the care that we can provide patients and families. So thank you.
Welcome and thank you, Robin. All right, Gina, you're up.
Okay, so I have a couple of brief updates. One that we actually left off our internal agenda, but we talked about, which is changes to imaging scheduling at the Med Center. Some of you may be aware that the Med Center allows patients to direct schedule mammograms right now. Beginning in mid-June, they are going to expand that to include CT and MRI scheduling as well. So patients will be able to go into MyChart and schedule those appointments directly themselves. You do have to be sure that there is an order placed in eRecord. So if you're an ePartner user, you need to place a record, script in there so that your patients can be able to use that feature, which is going to be helpful with this expanded capability that we mentioned out in last month's network news, where ePartner users are going to be able to directly transcribe notes in ePartner, which are going to reflect in eRecord. So really the Med Center's, trying to make some of these processes really smooth and seamless for you all there. So there's that expanded feature coming in mid-June. That is the expectation there. Some other notes on 2023 performance measures. So those are going to be released imminently. They are in the last stages of testing. Things are looking pretty good right now. And so we expect those to come. And so on that note, this is a really good time to start thinking about your practices, function in the PCP reward plan. What are the components that you need to be thinking about? And also access to the provider engagement report. We've been rolling this out over the last year so that when 2023 measures were rolled out, you guys were already able to get in there and see how your practice and your providers are performing holistically to the PCP reward plan. If you are interested in getting access to the to the PER, we are going to include a link to one of our support forms for the provider engagement report, which is going to allow you to request that access if you do not already have it. If you have access to the PER and are running into issues with it, you're seeing data and discrepancies or anything like that, you can also use the same form to get in contact with the AHP PER team so that we can troubleshoot you through that so that you're ready to run once you get access to those 2023 measures here soon. That is the PER. Now also, we talked a lot, Bob is on the call and he's not going to speak today, but we have been talking a lot about this switch to the New York RX program for Medicaid patients. The state is holding an all stakeholders meeting next week to discuss that Medicaid pharmacy benefit transition. So we're going to include information on that call in the follow-up for today. So you'll have access to that. The last thing that I have to say is we also spoke about translating our well child roadmaps into Spanish, and I'm really happy to announce that we do now have those printed in the office. So some of the groups that already reached out and asked for those, yours went out in the mail on Tuesday. And if you're interested in having those shipped to your office, please just reach out and we'll get them to you. So we now have that available as well. And I believe that rounds up my updates.
And if you do have questions about the Medicaid, pharmacy benefit transition, I'm happy to try to answer them. Or if you want to send me them, I'm still collecting issues that we're troubleshooting and looking into.
Thanks for bringing that forward, Bob. Yeah, we really do encourage you. If you're seeing some things, we mentioned this on the call before, sometimes as the system changes go into place, there's unanticipated consequences that actually increase disparities as opposed to, improving or reducing disparities. And so we want to really be able to highlight those and fix that. I happened to be at the pediatric academic meetings last week where a team from California was talking about what it was like when they went over to that centralized pharmacy. And there were, as an example, there were certain certain inhalers, that were really critical to adhere to guidelines, and they were no longer covered in that space. And so, really, and I know our teams have been the pharmacy teams have been very active in trying to anticipate that and assure that that doesn't happen, but you're on the front line, so you're going to see it very quickly. So please let us know if we can help forward those things onto the state for resolution. So we were quick. I'm looking at the chat. There's nothing in the chat. So I'm just giving a moment if anybody wants to unmute and has anything to add or to say. Clearly, I'm going to have to work on a little more of a comedy routine or song and dance or talk longer. If I fill in for Chad, I'm only joking. We miss him, but the Church of Chad was closed today. So we just needed to run our own. Any comments, any questions from the team who are here today?
I can throw out a teaser. We know that, there's new guidance from the CDC and stuff out on the bivalent COVID vaccine. So we're working to put together a little bit of a information for y'all that will get out in the next few days, probably, or early next week. Just finishing that, trying to make sure it's comprehensive and kind of collaborating with, both Rochester Regional, pediatrics, and adult primary care to make sure it's sort of a community message.
Excellent. Thanks, Bob. And I hear it's Chris's birthday. I'm watching the chat there. So happy birthday, Chris. I would do this thing one time when I think it was my birthday or somebody else's birthday. I remember we had everybody on mute and sing at the same time. It was one of the worst things I've ever heard. And so since we're being recorded, I don't think we're going to do that, but we all wish you a happy birthday. And I don't think there's anything else in the chat now. So I'm just going to say, we're going to give you back some time in your day, almost 30 minutes back. And thank you for tuning in. And we'll send out a summary. So have a great day, everybody. Take care.
Have a good one.